Hi, today let's talk about one of the biggest challenges that we face with patients that have lymphedema and also chronic venous leg ulcers, and that is fibrotic tissue. What is this fibrotic tissue? But also let's talk about the compression, because there's different types of compression and also different types of garments. And so to begin, fibrotic tissue develops when there's a long-standing accumulation of protein-rich fluid over the tissues. Now with time, chronic inflammation changes the tissue structure. The tissue becomes thicker, firmer, less flexible, and more resistant to fluid movement. This leads to an important question that many patients and clinicians may ask: can fibrotic tissue actually be reversed? And the answer is sometimes, but we need to understand what we mean by reversed. With more advanced fibrosis, the patients have significant tissue changes and remodeling, or goals may shift from complete reversal to reducing the impact of fibrosis. This is where compression becomes such an important part of your treatment. During the beginning phases of care, when tissues are congested and fibrotic, we often use short stretch bandages because they offer a higher working pressure. When the patient moves, it creates movement, and the system helps the muscle improve fluid movement and provide a mechanical influence on the tissues. That's why short stretch is important. As the limb improves, patients transition to long-term compression garments. And remember, not all compression garments are the same. So there's circular knit and flat knit garments. They work differently, but circular knit work well with patients that have mild swelling and good tissue integrity. However, when we're dealing with significant swelling, limb shape changes, or fibrotic tissues, flat knits are often preferred. Flat knit provides a greater containment and stiffness, helping resist tissue expansion and maintaining the shape of that limb. We also have to remember that lymphedema management does not stop at the end of the day. What happens at night? Because many patients require a nighttime compression system to continue managing the swelling. That's right, while they sleep. So daytime garments are generally not designed for nighttime use because they're made for upright activity and may not provide the appropriate comfort or pressure during prolonged rest. But the key message is that successful management of fibrotic tissue requires the right compression strategy at the right time.